Hello, everyone. This is Teresa Moore with the Conversation with T. And today we have Dr. Valencia Agnew again with us again. So excited. I really do hope you took the opportunity to watch our last show because it was absolutely amazing, eye-opening, so many wonderful nuggets inside there, but it just wasn't long enough. We just didn't have enough time to discuss all of the things, and we still won't have enough time. But she has been gracious enough to come and be with us for another show. I want to welcome you. Thank you again.
Thank you. Thank you.
Yeah,
It's good to be here.
good. Yeah, absolutely. Is the weather changing in Grand Rapids
It
yet?
is Yesterday it was 90 degrees and today I think it was 78 or something like that. So it's
That's
still
how
a
it
little
is.
bit warm and it might rain tonight, but who knows?
Yeah, as long as it's not rain, because I think Iowa and Michigan are kind of neck and neck. But I don't want to waste any time talking about anything, any other thing. Like I said, last week's or our last session was so amazing. You had me wanting to call you last week, and girl, it's wrong. So, because you have so much wisdom and understanding about what you're talking about, and we just don't find that a lot today. So, with that in mind, like I said, I'm not going to do a bunch of talking, but our jump off question, and I'm sure there'll be other things that will arise. But the jump off question is because last week or last time we talked about couples and mental health, or in a marital relationship, or dating, or just couples.
Mhm.
Um, what is the emotional weight on the children when a parent or parents struggle with mental illness?
You know, Before I jump into that, I want to tell you that I appreciate so much that you're doing this show. I appreciate having the
Oh,
opportunity to have this conversation. This month is Suicide Awareness Month.
oh
And,
wow.
and at my practice, one of the things that I emphasize is community education and outreach. And that's
Mm,
exactly what you're doing is education and outreach because there are some things that people just don't
yeah.
know. Like the
Mm,
questions that you're asking, the topic that you are discussing, if people don't know that there's something unhealthy happening, they don't
mhm.
know how to fix it. They don't know that there's help available.
Right.
They just think it's the norm. And,
Hmm.
and so I appreciate that you're shedding light on these type of topics and it gives people a chance to be whole, to be
Oh,
healthy, to be whole. So thank you for allowing me to be a part of that too.
oh well, I thank you for saying that. And I feel honored that you're here because I want to be a connector for different things in our community that so we can be healthier and stronger physically, mentally, emotionally, spiritually, because I think, like I said last, I think it's kind of taboo for us to talk about mental illness. And
Right.
it shouldn't be, because everybody at some point or another is down, depressed, sad, dealing with anger, whatever it is, all of us are dealing with that. So I appreciate you coming on and shedding light so, we can get a better understanding of ourselves and hopefully seek help.
Yes.
Oh
Yes.
yeah, yeah,
Get help. Recognize when we need it. Decrease the
absolutely.
stigma.
Yeah, exactly.
That it
I
will
mean,
be just as
wow.
normal as if you broke a leg and you would
Mhm.
go to the will be that normal.
Absolutely. Absolutely. Because it's okay. It's okay if you're yeah.
Yes.
I yeah,
Yes. It's
yeah.
okay to not be okay.
Exactly. So we have this stigma that, and as Black women, we are strong. We are strong women because
Mhm.
we have had to deal with a lot, but we still need that understanding of some days we just don't have it all together. Some
Right.
days we need we need a shoulder to lean on, or
Right.
those type of things, because we've got our husbands or significant others and children and aging parents, sometimes just a
Mhm.
lot of different things that we're
Yes.
trying to juggle. So yeah, I think it's amazing I don't want to always dwell on color, but I do think that is an issue.
Mhm.
Um, so it's great that you are a woman of color and you got your stuff together. You can be there to help. I hope everybody contacts Dr. Agnew. She can tell you better than I can about how she can help you. But man, please, 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 whoever is watching, whoever watches this later, take this opportunity if you are struggling with mental health to get better because there is hope. There really is help.
There is hope.
Yeah,
There is hope.
absolutely. Yep,
Yeah.
absolutely.
I say I have the best job in the world. And I know other people think they have the best jobs, but they're wrong. You know, I want to put that out there. They're wrong.
Yeah,
And
yeah,
you know that this is a job where I get to see people go on a journey,
yeah,
a journey, and I get to see the good, the bad, the ugly, the in
yeah,
between, the tears, the joys, the sorrows,
yeah,
you just walking alongside
yeah.
and seeing people grow and change.
Hmm.
And that's what this type of education does for them.
Yeah.
It even going to your question of, how does it impact the children?
Hmm.
When I believe, first off, that prevention is
Mm,
best.
hmm. Absolutely.
Intervention is good. Intervention is great. If you can have an intervention and change the course of someone's life, a course of a disease, an illness, an
Yeah,
intervention. But I tell you what, I'd much rather have prevention and
yeah,
never get it and never have to experience it. I laugh and I say, and I don't want to make light of substance abuse, but I say, I'm never going to have a problem with substance abuse. The reason why? Because I'm not going to start. I don't need to find out what's in my genes. I don't need to find out
exactly.
like family history. It's like,
Hmm.
I'm just going to prevent it right
Yeah,
off. And
absolutely.
and I realize that
Absolutely.
can be easier said than done,
Hmm.
but talking about how children are impacted gives us a chance to look at some preventative things and to look at what parents can do differently. I used an example of my own self last time, and I'll use an example again of myself when COVID first happened and everyone was on lockdown, and so I'm working from home and I'm trying to um, work with clients, and my son was home and I think he was in fifth grade at that point.
Okay.
And so I'm trying to do fifth grade math and everything else that they had to do, and he had to be on Zoom and all those things. And there was a point where it really felt very overwhelming for me.
Yeah, I
Like,
can understand that.
how do we all have our own space in the house?
Hmm.
And some people aren't fortunate enough to even be able to have their own separate spaces in the house.
Hmm.
We could have separate spaces, but the volume's carrying, and it was a lot. And I was feeling like loser mom. I was feeling like
Wow.
I'm not doing enough to help him. What happens if in the fall he's not prepared for, the next grade because I didn't know enough, didn't teach enough, didn't get it right enough,
Mm,
something. And, and I would have a hard time with like, I'm trying to teach him something. And, I teaching kids math is not my strength. There's some things I have patience for. Math just is not it. Paige
hmm.
could tell you some stories. It ended up with Vincent helping her a whole lot more than I did with math.
Hmm. Yeah.
And so there was one day where I started to cry because it's like I'm just having such a hard time, and more than my normal, I'm a crier. It was my like I'm aching kind of
Mm.
I'm sad with all of this. And then Curdy started to cry too.
Oh, wow.
And he's crying too, and he's thinking that he's frustrating me,
Okay.
that he's letting me down, but really I'm feeling like I'm letting him down. And
Hmm.
and I had to tell him, it's like, you're not doing anything wrong. This isn't about you. This is about me, that I'm feeling like I'm not getting it right. But here's the thing is that I could be self-aware enough in that moment to be able to say that to him. But imagine a parent that's feeling depressed at that time. Can they be self-aware enough to be able to say that to a child? Maybe not, because they're so spent already. They already don't have a lot to give. And everything that they're giving, it's sort of like running the car on fumes, on gas fumes. You know, having the tendency to keep pushing when you got nothing else to push with. And so a parent that might be depressed is pushing ahead, but not really aware of how much of an impact it's having on that child.
Okay. Wow.
Because they think they're doing what they need to. And often we'll have parents that come into session and we try and tell them that they should go to therapy as well. I think every time a parent has a child in therapy, they should also be going to therapy.
Okay.
And the reason why I believe that is because it's not just drop a child off to be fixed. It's the system, the family system has to change.
Okay.
If the system doesn't change, the theory in psychology is that the system will rally together to stay the same. So it's like one person may take on the illness of the family or something. For example, the kid who might be the class clown that's taken on some issue that's within the family. Or a kid that may be physically ill all the time, who's literally taking on physical illness of the system. Or maybe the dad who says, I'm working on anger management. I really need to work on this. I'm depressed, and often depression in men can look like anger. So it can be, you know, he can be angry and he's working on it and he's coming home and he's trying to, you know, be more patient. And the wife may say, like, how come you didn't get the bread? You know, I wanted the white bread, not the wheat.
Okay.
And there he is with that challenge of, okay, don't express the anger that I'm feeling because I don't feel appreciated, that I at least stopped.
You're right.
Or maybe the very thing that he has said to the kids over and over, I hate it when you leave your shoes in the middle of the floor. It's so frustrating for me. And then what do the kids do? Leave their shoes in the middle of the floor even more. And even more. Now mom's leaving hers because she's sick of them. And, you know, the dog's toys are in the middle of the floor. And so the very thing that the system wants to change, it's like the system rallies together to keep it the same.
Okay.
So that can happen. And then, like I said, that lack of awareness, because parents come into therapy and they believe, and they really are doing their best. I'm not usually about throwing blame on parents. I think there's plenty of blame to go around, but they will come in and think that they're doing everything right. And there's nothing else for them to do, when it's like, you know what, you think you're validating your child, but you're not.
Okay.
Really what you're doing is telling them why they should be okay, why they should be grateful for what they have. You think they haven't thought about, they have food, clothing, shelter, and still they're struggling, still they're unhappy, still they're like not healthy? Do you think that people wake up in the morning and want to have issues? So it's really important for parents to be in therapy themselves if their children are in therapy. Because sometimes, let's just face it, sometimes those little kids can seem like baby's kids, you know, that it can be hard for parents.
You're right. You're right.
And they're like, they can't tell anybody else I want to beat my child, because that's not okay.
No.
You're not supposed to beat your child. I'm not going to support you beating your child. But at least you go to therapy, you've got somebody that can support you and tell you how to validate them and help you understand what's going on with them. And if a parent is struggling themselves, that's a hard thing to do.
Yeah, absolutely.
And it's really difficult. If you could think of a time when maybe you were really sick and you didn't feel well, and you reflect back on that week and you realize, I don't even remember when I did that. Like when I cleaned
Yeah.
whatever. It's like I don't
Hmm.
remember it because I was too sick. I was like in a brain fog and I don't remember. Or think about a time of like grief of, where you're really hurting and you're doing things on road. You're just
Yeah.
doing it because got to get up, fix the
Right.
cereal.
Right.
This is what you have to do. You don't have an option to not go to work. So you go to work, but maybe you come home and you go to bed and so parents can think, we're doing it. And meanwhile, the child is suffering. And
Yeah.
there's different ways because it's easy to notice the kid who's getting into trouble.
Hmm. Very true.
But it is very difficult to notice the kid whose grades got better.
Hmm.
They started doing better and then they become the invisible one, and parents don't realize that that child is suffering too and that their behavior changed drastically as well.
Hmm.
But because it looks like to society, to
Hmm.
everyone, it's for the better,
Hmm.
the attention isn't being paid to, but it's different, it's
Yeah.
drastically different, and you need to pay attention because you don't want that kid to slip through the cracks because
Right.
you're not going to keep bothering them like, hey, what's going on?
Yeah.
They're just in their room silently suffering,
Yeah.
but you think great because they're just doing so well at
Right.
school.
Yeah. Yeah.
Oh,
So staying in that vein of thinking about a child who is dealing with mental illness, because you hear about the school shootings and you hear about these children, young people, regardless of the age, they'll get a gun and then they eventually find out that they were bullied or made fun of in school. Are there any telltale signs for that? And I know that that's a really broad question, but what should a parent look for when if they feel like their child may be going down that road because of mental illness?
one of the things that first I'll say to parents with children of color, pay
Mhm.
attention to your children.
Yeah.
Pay attention because statistically, the rates of suicide for young adults, young children, adolescents is
Hmm.
higher and growing.
Wow.
And also they are much more apt to be considered as problem kids in school, whereas white children are much more apt to be thought of as having depression and anxiety. So parents
Wow.
would be contacted, oh, well, Johnny is got anxiety, is got depression. You probably should look into therapy.
Hmm.
The child of color is like, problem
He's
child. We
being
need
back
to get
right.
it together.
Wow. Wow.
Yes. So
That's
statistically,
sad. That's sad when you think about
it
that.
is. It
Yeah.
is. It is very sad. So
Mm.
parents of color should definitely, I think all parents should pay attention, but
Right.
definitely parents of color, pay
Okay.
attention.
Okay.
And because we're much more apt to say, suck it up, life
Yeah.
is hard, do what you need to do.
Yeah.
Don't expect anyone to give you anything. You have to work harder than anybody else has to work. A dad might say, I'm trying to prepare him for the real world.
Right.
But
Right.
you know what? The real world, he doesn't need to be prepared for the real world that way. He needs to be loved.
Yeah.
He needs to
Listen.
know hold is safe.
Absolutely. Yeah. Yeah.
So don't toughen him up for the real world.
Yeah.
Love him up at
Yeah.
home
That's
so
true
that he's
because
ready for the real
yeah,
world.
absolutely. Because if any child knows that they can go home to get the support and love that they need, then maybe they will be more apt to have conversation if there is an issue that's going on. Well,
Yes.
so are we is there a specific age? Are we looking at teens? Are we looking at middle school, grade school that have more issues, emotional issues, I guess I can say.
Well, we're definitely seeing it a lot more with younger kids.
Wow.
Younger kids, oh gosh, it can be heartbreaking
Hmm.
sometimes. The younger kids where parents are calling and saying, my 8-year-old has a porn addiction.
Oh wow.
Yeah, like
Yeah.
how?
Right.
oh,
Right. Yeah.
and have some guesses about how, but yeah, so the issues and thoughts of suicide, like what 6-year-old should be thinking
Wow.
about suicide?
Right. You haven't even started living yet.
Right,
Wow.
right.
Mm.
But the rates statistically are more the 15 to 24-year-olds. And
Hmm.
and so things that parents can notice are, first off, if there is a change in behavior, a significant change in eating, sleeping, grades, doing homework, friends, time that they spend with you versus not spending any time
Mm.
with you, or
Okay.
all of a sudden wanting to spend more time with you.
Hmm.
Any sudden changes and that are lasting for a couple of weeks. So you don't need to
Okay.
wait 6 months and say, it's been about 6 months. No, 2 weeks is plenty long enough
Right.
to say
Right.
that there is an issue.
Hmm.
And and not every child is going to need a whole lot of therapy to process through it. It may be that they only need 3 to 6 sessions to process through whatever was happening at that
At
moment
that time. Yeah.
and get the
Okay.
skills so
Hmm.
that they're equipped to start handling things later.
Yeah.
There's just so much in the conversation, like even the research about kids who spend more time on gaming and the internet and things
Mm.
like
Okay.
that have less social skills, less
Mm.
skills to be equipped to handle problem solving. Like they
Okay.
can problem solve within the video game, but outside, real life situations that come up, that they struggle a little bit more with how do they manage the emotions? What do they do?
Wow. Yeah.
And so those are things to pay attention to. And and I say being aware of what's happening with your kids
Hmm.
online. You don't have to always, it really doesn't need to be in an interrogation. Being
Okay.
an involved parent can be helpful. And and that's, I don't want it to come across either that anytime a child struggles, it's the parent's fault, that they should have noticed it, or that, they've taken their
Right.
life.
Yeah.
The parent should have noticed that. It that's not always possible for
Right. Right. I mean, right. Parents are working. They're, if there are other children in the home, they've
oh,
got a full plate. So, that's very, I'm glad you said that, because
yes,
I would hate to think that every parent who is trying their hardest feels like they're failing just because their child has an issue. This world is hard.
yes, it is.
And, it, so yeah, I don't want to start talking because I'll start chit chatting, but I want you to continue on, because it breaks my heart to hear that a 6-year-old would think about suicide.
Mm,
But I mean, that's what our society is kind of like telling you. If you can't deal with the issue, then you can do this, or you take drugs, or you can just end it all. And that's kind of sad to me.
right. Especially when there are skills
Mm.
that they can learn. And we have a children's DBT program, which
Okay.
stands for dialectical behavior therapy at our office.
Okay.
And the children's program is for 7 to 12-year-olds. We have an adolescent program and adult, but we
Okay.
have a children's program because what I call the little bitties, they, you know what? They have really big emotions
Yeah.
and they don't know what to do with them. And their
Yeah.
brains, as it is, as a teenager and young adult, your brain isn't completely developed. Well, these
Hmm.
little tiny things, their brains really aren't completely developed. And sometimes when they say, oh no, it's because they really don't know. All
Yeah.
they just feel these big emotions, and something may have triggered them and they don't know what to do with them. And so they need these and things to help them. So
Hmm.
yes, we have the little ones come in with big emotions
Yeah.
and in times when they don't want to be alive because they recognize the way that they're living is painful for them and they don't know what to do with it.
Yeah. Yeah.
But they've learned that that suicide is an option. somehow.
Yeah. Yeah. So are there particular triggers for that a parent could watch for? Um, or maybe to if their child is dealing
You know,
with an
say,
emotional issue?
yeah, when you, like I said, the 2 weeks when you see things changing in patterns and behaviors,
Hmm.
um, maybe it could be thought changes, them becoming more quiet, more withdrawn,
Okay.
or all of a sudden, wanting to give away things to other
Oh
people,
wow. Okay.
or having talks about death. That's another thing, is that people in general tend to be afraid when someone starts talking about death or suicide, or that they just don't want to live anymore.
Okay.
You will not make someone suicidal by having a conversation with them about suicide. I can talk
Okay.
to you all day about suicide. It is
Hmm.
not going to make you decide, I think I want to take my life. That's not how it works.
Yeah.
But what does happen is when you can have conversations with people and not freak out about it, that then opens the door for them to process what they're thinking and
Okay.
feeling, and being able to trust you that you can handle the tough conversation. So
Hmm.
having a conversation actually can help your child. It is not wrong for a parent to pick their child up from school and to say, have you ever thought about suicide? I was watching
Okay.
this show, or I was watching something on TV, and I just wonder, do you ever think about that?
Mm,
Okay.
okay.
And you have a conversation. It's not going to make them suicidal, but
Okay.
it'll tell you a lot if they respond, if they don't respond, if
Yeah.
they pause, things that can take that conversation a little bit
Hmm.
further.
Okay. Okay. Because I would be the one that would think, well, if I mention anything about it, then they might start thinking about it. But that's good. So if you have an older sibling that is dealing with emotional issues, what are some of the ways that a younger sibling can kind of deal with that? Because I've seen in movies that where the younger and the older sibling were close, and then all of a sudden the older sibling pulls away, and that's difficult for the younger sibling because they don't understand. So what are some things that to deal with that?
So, parents can have candid conversations with that child about how hard it must be that your brother used to play with you all the time, and now
Okay.
he doesn't want to play with you. That must be hard.
Yeah.
That must make you feel sad. And I really like using movies
Hmm.
with young people in therapy. Like, that's one of my fun ways to do therapy. So that question, immediately what comes to mind is Frozen, where
Okay. Yeah.
Anna and her sister, where she keeps like, will you
Hmm.
come out and build a snowman? Can we
Yeah.
play? And she's going up and down the halls trying to get, like, wanting her sister to come out, and
Hmm.
having very candid conversations. And it's okay for a parent to say, it makes me sad sometimes to see that too. Or, we're working on it because you know what? He's having a really hard time right now. So we're going to love him through it. But meanwhile, don't forget to keep loving on that child,
Mm.
because when you talk about the family system and how kids can be impacted by parents' mental health, if parents have to focus all of their attention on the kid that has the mental health issue,
Hmm.
inadvertently leave the other child developing some
Right.
issues, because mom and dad have to focus every waking moment on him or
Yeah.
her. They
Wow.
always have
Yeah.
to be worried about if they're going to hurt themselves or if they're going to hurt somebody else. They're
Mm.
always having to take time off of work. Mom's
Hmm.
always crying about this one. And it doesn't mean, I am not saying mom should not cry, that parents shouldn't have feelings. They should have
Hmm.
feelings.
Absolutely. Yeah.
Obviously, have their big feelings with their therapist or in private.
Hmm.
Don't be laying on the floor in a puddle of tears.
Right.
But
Right.
it is okay to cry and tell your
Hmm.
other child, I feel sad, because they also learn strength by watching parents take care of themselves. So when I'm crying with my son because I'm feeling awful, like loser mom, trying to teach him and trying to work, and
Mm-hmm.
being able to say to him, I can take care of myself. You don't have to take care of me. I'm just sad right now. I
Right.
just feel
Yeah.
bad about this, but I can take care of myself. And
Mm-hmm.
what are we going to order for takeout dinner? Because you know what? We need to have like some ice cream or something because, whoa, this was hard.
I love it. I
Or just
love that.
something. Let's watch a movie. You
Mm-hmm.
know,
Yeah.
they know
So
it's like mine. It's like, let's go to a movie because that's a self-care thing for me.
right, right, yeah. It's what I hear from even the last show and this show is communication.
Mhm.
You have to communicate. And if you're not communicating with those in your household, you're going to miss something. I remember in my days, and I'm telling on myself how old I am, we used to sit down for dinner, at the same time. It wasn't, you come in and get this, come and get this, and then you go to your room or whatever. It wasn't until most of my siblings were grown and gone before that came about. But
Mhm.
it was just a time for everybody to sit and to talk about your day. And so I want to encourage, I'm not the doctor, but I
Mhm.
want to encourage
Oh,
everybody to talk. You know, you might not have the words to say. Reach out to a therapist if you don't know. If
right.
you don't know how or what to say, because I mean, don't be afraid that, oh, no, you're an idiot or there's something wrong with you,
Yeah.
because if you're not taking care of yourself, nobody else will. And I
Mhm.
just think, yeah, I've heard you say a number of times, you got to do self care. You got to do self care. And so I think that's for everybody. Everybody can't afford to go on vacation, but you
Mhm.
can have a staycation. I used to do picnics in the living room with my children. And it was
Mhm.
like we were at the beach. We'd watch a good movie and have snacks and just have that together time. And I think if everybody can communicate, you know, especially in a family, I think we do a whole lot better.
You know what? I'm with you. With my grandsons, we we during COVID, we got a I borrowed the projector from work and put it on our
Oh,
little
that's
porch
cool.
and hung up
Yeah.
a sheet and we draped some sheets around and it's like we can sleep on the patio
Oh, I
and
love that.
because it's an enclosed like
Mm-hmm.
little
Mm-hmm.
patio, we can sleep on the patio and watch a movie. And one of them even mentioned to me recently, like, remember, Grandma, when we watch movies on the patio?
Oh,
And it's,
that's great.
you know what, that just kind of like
Yeah.
warmed my heart that
Yeah.
that he even remembered enough
Absolutely.
that like it mattered to him.
I
And
love that.
so, yeah, we can't all afford to go get a massage. We can't all
Yeah.
afford to go get
Mm-hmm.
our nails done. But we can't afford to just sit and prop our feet up for
Yeah.
a little while and give ourselves permission to enjoy it without feeling guilty
Yeah.
about the dishes have to be done. And,
Mm-hmm.
and we can write affirmations to ourselves. I keep an affirmations journal on my phone
Okay.
and so whenever someone posts quotes or something on Facebook
Mm-hmm.
that I love, I just save it into my Dropbox.
Mm-hmm.
And I have in my Dropbox, I have a folder called inspirational quotes.
Mm-hmm.
And sometimes I just go back because I need to be reminded of who God says I am, or I
Absolutely. I
need
love
to be
that.
reminded that life is not as bad as I think it is, or
Yeah.
just something that I
Yeah.
need a reminder. It could be somebody might send me a text message and it's like, oh, I want to remember that for a different day. And I'll cut and, screenshot it and
Mm-hmm.
see in my quotes because that is a self-care for me in times when I need to hear something other than you're a loser mom, you're not getting it right
Yeah.
with
Yeah.
school. It's like, you know what? I have to have something that speaks the truth and counters those negative messages rather than just, accepting them as like they're the gospel truth or something.
Right. That's
So,
amazing. Well, I just want to thank you once again. We're getting low on time, but I just want to thank you so much for your expertise. I really, really hope audience, you've got to listen to these conversations. You've got to reach out to Dr. Agnew. She'd love to hear from you. She's got a staff, she's got her own practice. I am so happy you were able to join us this evening for a conversation with T. And I hope you take the opportunity to talk about your mental health with your family. Thank you so much for joining us. Bye.
Thank you.